Welcome to Fast and Furious MCQ edition. Let's learn about the parameters in the vaccine and the policies which are followed in the vaccine. First is the vaccine vial monitoring, that is VVM. It is most usually in case of PHCs to monitor the exposure of heat to the vaccines or vials, and the correct usage of the vaccines can be done by this vaccine vial monitoring technique. According to this technique, a heat sensitive label is placed over the vial, either at the body of the vial or at the neck or at the top of the vial, and according to this reading they can be classified as 1, 2, 3 and 4. In vaccine vial monitoring, the chemicals are present at the outer circle and inner square, and this should be read before administering the vaccine. When the VVM vaccine vial monitoring is read, the inner square color is lighter than the outer circle, then it is categorized under 1 and this type of vaccine can be used. When the inner square is much lighter than the outer circle, and this type of vaccine are also used. When the inner circle and inner square and outer circle can't be differentiated, they are at the same color, it is categorized under 3 and these are not used. When the inner square is much darker than the outer circle, then it is categorized under 4, it is also not used. This is the vaccine vial monitoring, and it is also used in case to identify that which vaccine should be preferred or used first. Suppose if the vaccine is present at the stage of 2, it is much earlier used or it is used first than the vial with category 1, so that the wastage of vaccines can be reduced. Next, moving on to the open vial policy, which is followed for the vaccines. Open vial policy means once the vial is open, that vaccine can be used for subsequent dosages for up to 4 weeks. And to remember this, the mnemonic is open vial policy taken for hepatitis B. Here, open vial, OPV vaccine, and P stands for pentavalent vaccine, and T stands for tetanus, toxoid and DPT, and hepatitis B is the hepatitis B vaccine. These are the vaccines which follow the open vial policy, and the remaining drugs or vaccines does not obey the open vial policy. That is, once they are opened with or without usage, they should be discarded.